A very good morning to everyone. Today topic for lecture is Introduction to Respiratory System. The first slide which is presented to you is showing you the diseases which form the spectrum of respiratory system. So tuberculosis, commonly known as TB, you must have heard. Asthma, chronic obstructive pulmonary disease, which includes chronic bronchitis and emphysema, bronchiectasis, pneumonia, pleural effusion, and lung cancer. So these are the common diseases. Some of them are very common and some of them are rare, which you usually encounter in a patient who present to you with respiratory symptoms. So now let's see what are the symptoms of respiratory disease. The common symptoms of respiratory diseases are cough, sputum production, hemoptysis. Hemoptysis means uh, uh, coughing out blood in the sputum. Then breathlessness, having difficulty in breathing, chest pain. Chest pain, you always need to differentiate between a cardiac chest pain and a chest pain due to a respiratory disease. And here, one thing I would like to add that hemoptysis is blood in the sputum. There is a similar term which is hematemesis. Hematemesis means blood in the vomiting, and that is often a system of GI disorder. Then fever is a very common symptom which you often encounter in respiratory disease. Then upper respiratory tract symptoms which include flu-like symptoms, having sneezing, running nose, or just discharge from the nose, sinusitis, all these form the upper respiratory tract symptoms. And then comes the constitutional symptoms. Constitutional symptoms are a group of symptoms which are usually present with chronic diseases. So they include weight loss, malaise, weakness, fatigue. Now next slide you can see is a girl which is showing that she is having tuberculosis. So tuberculosis is caused by a bacteria, mycobacterium, and earlier it was a very deadly disease. People used to die a lot, but nowadays you have such a good treatment. सबने डॉट्स का नाम सुना होगा. So DOTS is a new therapy and cures tuberculosis completely. This is a slide which is showing you how a tubercular lung looks like. Then this is a normal X-ray. So you can see the black part is the shadow of the lung because air is filled in it, and the white part is the bony part. You can see the rib cage, the sternum in between, and the clavicles. So here you see that lungs are normal in shadow. There is nothing which is obstructing it. Now I'll show you a picture which is X-ray which is showing you active tuberculosis. So here you can see white bands like structures which are fibrotic bands. So you can clearly see the difference between a normal chest X-ray and a tubercular lung X-ray. Now tuberculosis in India has the highest burden, accounting for more than 1 by 5th of the global incidences. And why tuberculosis is high in India? Because of overcrowding, not very good ventilated houses, poor immunity. So all these are the causes which lead to the higher rate of tuberculosis in country like India. So globally, if we have 9.4 million patients, India alone accounts for 1.96 million cases. So now the target of India is to eliminate tuberculosis in India by 2025. And these four are the cornerstones, the four pillars on which our strategy is based. That is, detect first, treat it, and build the immunity, build the treatment, and prevent the recurrence or prevent the spread of tuberculosis. Next slide you can see is the slide showing you an asthmatic patient. So what happens in asthmatic patient? The lumen of the bronchi, it decreases. So there is reversible narrowing of the bronchioles, leading to the difficult in expiration. So you can see the upper picture is showing a asthmatic bronchiole where the lumen is very short, and the picture showing below is you can see a normal bronchiole with such a patent lumen. So according to the global burden of disease in 2015, COPD and asthma rank among top 20 conditions. So they are so common. And nowadays you can see asthma is very common in young children also. 300 million individuals currently suffer from asthma worldwide, and out of that, every 10 asthmatic, one live in India. Then comes another important disease, that is bronchiectasis, abnormal and permanent distortion of one or more of the conducting bronchi. So this is something which is concerned with the bronchi. Then comes the emphysema. Emphysema is the abnormal permanent enlargement of air spaces distal to terminal bronchioles. Now this in upcoming slides I will tell you what is the difference between a bronchi, bronchiole, terminal bronchiole, respiratory bronchiole. So we'll study in further slides, but for now you can understand that it is the distortion of the air spaces. So mainly it affects the alveolar wall. And the next slide shows you that this is how an emphysematous lungs look like. And one of the contributing causes for emphysema is smoking, and next is the air pollution. Some of the cases are due to the hereditary transmission. The disease is common in male, but smoking acts as an important factor in leading to the pathogenesis of emphysema. It destroys the lung tissues, causes inflammation and irritation of airways. Then chronic bronchitis, you add anything, itis to anything, that means itis means inflammation. So itis bronchitis means inflammation of bronchi. So chronic disease, a disease which is, is not of a recent onset, has been for months, is known as chronic disease. So chronic bronchitis usually presents with persistent cough. So again you can see the two pictures. One is showing you a normal bronchi and another is showing you a bronchi which is inflamed. So you can very well see the edema present here. You can see the walls are inflamed and the lumen has narrowed. So this is how the inflammation of the bronchi presents. Now this is a picture which is showing you the chest X-ray of pneumonia. This is the normal lung tissue. This is the normal lung tissue. This is the shadow of the heart, and here it should have been the black part. If the air was present here, it would have been the black part, but it is a white patch. This is the consolidation of pneumonia. So this is a chest X-ray which is showing you the chest X-ray of pneumonia. Then you can see laryngitis. This is the vocal cords. This is the part larynx. You can see the inflamed vocal cords and everywhere inflammation. So the inflammation of the larynx causes hoarse voice. Hoarse voice means a thick voice, not very clear. And sometimes it also causes to the complete loss of the voice. Now this is a healthy normal vocal cords and a normal healthy larynx, and you can see an edematous pic here. So now you can clearly make out the difference. This is all exudates, the secretions present due to the inflammation, and here it is a normal healthy vocal cord larynx, and you can see the trachea deep bare. Now you all know that both lungs live inside the rib cage. आगे the in front there is sternum, then there these are the rib cage ribs, and they attach to the vertebral column posteriorly. Now the two lungs and the heart in the center lives inside this protective rib cage. So, respiratory diseases not only include those diseases which inflame the bronchi, the lung, or the alveoli, but they also constitute the diseases which are caused due to the rib cage abnormalities or sternum abnormalities. In the upcoming pictures, you can see you can see it is tilt. Here you can see there is slight bending, lateral bending. Then you can see a pic. Here it is an exaggerated depression of the lower part of the sternum, and this is known as the funnel shaped chest. Then you can see the bulging of the sternum. This is a normal chest. You can see normal chest, and this is the bulging of the sternum, and this is known as the pigeon shaped chest. So in various respiratory diseases you can find these kind of chest. Now coming to our topic, what does the word respiration means? Respire in Latin words means to breathe. And what is the aim of respiratory system? The aim of the respiratory system is to provide oxygen to the tissues and to remove CO2 formed by the tissues. And why we need oxygen? Because unless and until oxygen reaches the cell and the glucose reaches the cell, the energy, the ATP production cannot occur. So for ATP production, we require oxygen and glucose in the cell. Now the respiration is of two types, external respiration and internal respiration. What you study in physiology is external respiration, and what you read about it in biochemistry is internal respiration. So what external respiration means? Pulmonary ventilation. Pulmonary ventilation means the air is going in and out of the lung. This is ventilation. Pulmonary means lung, and ventilation means the flowing in and out of the air. Then comes the pulmonary diffusion. Diffusion means from the lungs the oxygen is entering into the blood, and from the blood the carbon dioxide is diffusing into the alveoli and is thus breathed out of the nostrils. And transport of gases, that is, once the oxygen enters into a RBC or blood, it needs to be taken to the cells which are distantly located. So now the transport of gases occur. Oxygen goes from lungs to the tissues, and carbon dioxide comes from the tissues to the lung so that it can be expelled out. Now, earlier we had unicellular organisms. So the mechanism of respiration was very much simple in these organisms. The air used, they were one cell. They had one plasma membrane, cell membrane, and the oxygen or carbon dioxide, they simply used to diffuse in and out. And there was 100% usage of oxygen. Now, as the complexity or the diversity of the organisms increased and the organisms became multicellular, the cells were very much deeply located. So now how the oxygen will reach to each and every cell which are so deeply or distantly located away from the lungs? So we needed a well developed respiratory system. So that's why we mammals have such a good elaborative respiratory system so that oxygen can reach in every cell. The next pic shows you the trachea. If you touch your throat, you can feel these rings, and these are the bronchi. I'll explain it in another slides also. This is another picture which is showing you trachea in the between. These are the two lungs, and the heart is located here in between these two lungs. So this picture doesn't show you the heart, but this space is for the heart. And you can see the trachea dividing into two. These are the lungs. Then you can see the balloon-like structures here. The million of alveoli are present in both the lungs. And you can see this trachea is further narrowing down and dividing down into multiple branches. So this is called a tracheobronchial tree. So when we are talking about the lung, let's see what are the functions of the lung. So the primary function of the lung is gas exchange, and also it participates in the defensive system, and it also acts as a metabolic organ that synthesizes and metabolizes numerous compounds. Now see how many lungs do we have? We have two lungs, right and left. The right lung is divided into three lobes by two fissures. So the three lobes are upper lobe, middle lobe and lower lobe. And the left lung is divided into two lobes by oblique fissure, and they form two lobes, upper and lower. The next pic will clear you this. You can see here is the trachea dividing further into multiple bronchi. Now this is the right lung which is dividing. You can see it has three lobes, and you can see the two fissures, the horizontal and the oblique, and it divides the lung into three parts. And the left lung has only one fissure, oblique fissure, and it divides the lung into two lobes. Again, another diagram showing you the three lobes in the right lung and the two lobes in the left lung. This is known as the oblique fissure, and this one is the horizontal because it traverses the lung in a straight line, and this one is the oblique fissure because it is traveling vertically bit downward. This is another diagram. Here you can see the heart is situated in between, and then you have two lungs on either side, and all these are present in the rib cage, and rib cage protects both the lungs and the heart. Now both of these lungs are covered by a membrane which is known as the pleura. This pleura is divided into two, visceral pleura and parietal pleura. So if in anatomy they'll teach you that these lungs, they have a covering of membrane. The one which is almost attached or adhered to the lung is known as the visceral pleura, and the another one overlying it is known as the parietal pleura, and the space between the two pleura is known as the pleural cavity. Now this parietal pleura, it contains blood vessels, and these blood vessels, these produce an ultrafiltrate which is called the pleural fluid. The pleural cavity has a very small amount of pleural fluid, that is approximately 10 ml, and it allows the smooth gliding of the pleurus so that during the respiration the friction doesn't occur. And because the parietal pleura keeps on producing the fluid, so somebody needs to suck it out. So what visceral pleura does, it has lymphatics which keep on draining this fluid. So parietal pleura produces the ultrafiltrate through its blood vessels, and visceral pleura through its lymphatics keep on draining it out. So now here we have two diseases. Pleural effusion is when this 10 ml of fluid changes into a larger amount. So excess of fluid in this space, pleural space, is known as pleural effusion. And if by chance the air enters in the pleural cavity, this is known as the pneumothorax. So let me finish with the last slide. That lungs are contained in a space of 4-liter volume, but they have a surface area for gas exchange of a tennis court. And how it is possible? This I will tell you in my next lecture. The larger surface area is composed of independently functioning unit. So about these functional units, we will also discuss in our next lecture. Each unit is structurally identical and functions like every other unit. So this was the first part of the introduction to respiratory system. Rest of the part will be covered in the second lecture, part 2.